What are the 5 causes contributing to a turkey neck, and what are the things that you can do about it? Hi, I'm Brittany. I'm an aesthetic NP from Maryland. Let's talk about it. Okay, so we have multiple things going on contributing to the dreaded turkey neck. This is one of the first things that draws women in particular into the clinic wanting to know, hey, how do I tackle this issue? It bothers me. And the reason for that is as we age as women, we are losing bone volume faster than men. So we're going to get into the 5 causes of turkey neck, especially as we get older. So number 1, we're going to talk about a loss of elasticity, a loss of collagen in the skin. So if you think about collagen in your skin when we're young, think about a baby's skin, how buoyant and soft it is, almost like a Tempur-Pedic mattress. That collagen is responsible for keeping that skin nice and thick and plump. It doesn't want to wrinkle on itself. It doesn't want to cave in. It has a lot of elasticity from elastin, so it has good stretch. It comes right back. It provides that underlying scaffolding that just allows the skin to be stuck to the underlying structures, for lack of a better word, right? So the skin's thick, it's plump, it's stuck. Think of that when you think of collagen and elastin. Well, after age 30-ish, we start to lose 1% of collagen per year. And as women, again, during menopausal change, that number skyrockets and our skin is getting thinner, 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 and we're losing the elasticity. So not only is it becoming more lax, right? It's a little bit more loosey-goosey, whereas before it was very adhered, and it's thinner. So you're seeing things now like the underlying structures, the platysmal bands, the vascular structures. With regard to collagen and elastin, you're also noticing an accumulation of UV exposure on the skin. So photoaging or sun damage. You're having more pigmentation issues, maybe more visible vascularity, capillaries, redness, sunspots, age spots that are just contributing to a person's overall unhappiness with the tone of the skin. The second contributing cause is changes in fat distribution. So for some people, they do naturally genetically have a predisposition to having a little bit more fat in the submental area. And with age, that can accumulate. And so where they once had a little bit more of a sharp jawline, now it's more of a straight line from chin down to neck because of that fat distribution. You're also noticing in some people a loss of fat. Now the neck isn't a tremendously fatty area, but it does have fat deposition for sure. And with age, that can disintegrate. And again, it's looking thinner, it's looking more gaunt. You can see the underlying structures a little bit more. So when you have fat loss, you're just amplifying the visible effects of that loss of collagen and elasticity. So you're noticing the skin doesn't look as tight. It is more loosey-goosey, and perhaps there's a little bit more fullness in this region. The third contributing cause to turkey neck with age is the changes in the muscular patterns. So we do have a platysmal sheath that goes down into the platysmal bands. And when you flex your neck, you can see them. Now, when we're young and we have a little bit more fat distribution there, more collagen, more elastin, the skin's tight, you don't notice it quite as much. But when you add all these things up, now you start to notice these vertical bands even more. And as we age, those muscle bands can get stronger. Now their job is to attach to the platysmal sheath along the jawline and pull it down. So you're having a worsening of the appearance of the jawline because everything's wanting to pull, and you're seeing these vertical bands even more because of the loss of collagen and fat distribution. The fourth thing we have is a loss of bone support. So as we age, we know that our bones are resorbing with age. They're getting smaller in the face, right? So we know the maxillary bone that houses our upper teeth is receding inward. We know that the orbital bone is opening up and getting wider. And with the mandible, that's one of the first places for bone resorption to happen, in particular for women. And we lose that structure of the bone, in particular the gonial angle, which is responsible for giving us that appearance of a sharp jawline. So when these bones resorb inward, now it kind of goes from cheekbone just right down to neck. There's no support here. There's no underlying structure. And when you combine that with some of the ligaments in the neck getting a little bit more lax or loose, you just lose that definition. You lose that sharpness, that tightness that gives you the definition that you once had. So what factors play a role in these things happening? Well, absolutely genetics, which we really don't have much control over that. But there are a lot of lifestyle factors that play a role that you can control. Number one being UV exposure. If you just put sunscreen on every day, not just your face, but bring it down your neck, your skin will hold on to collagen and elastin much longer. It will ward off the effects of photoaging and a loss of elasticity for as long as possible. Number two is smoking. With smoking, you know that the blood vessels in the body are constricting. You're having a reduced amount of blood flow and oxygen to the tissues, and that includes the skin on all areas of the body, including the neck. And so you're going to have what's called more oxidative stress, which is just a fancy way of saying more aging and more DNA damage that's happening in that area that just propels all of these other things to happen faster. Weight fluctuations play a huge role. When you're gaining and losing and fluctuating back and forth, you do see that in the neck tremendously. And overall, just gives a less defined neck and things appear a little bit more loosey-goosey, if you will. So what can you do about all of these changes and how can you slow them down? In regard to UV damage, collagen loss, elasticity loss, number one, as I mentioned, wearing sunscreen can prevent. That's step one. Number two, in your skincare, please use some sort of antioxidant, whether that's a vitamin C or an antioxidant blend. What an antioxidant will do is ward off that oxidative stress and that DNA damage for as long as possible to keep the skin holding on to its collagen, elastin, and its youthful appearance for longer. You can also consider wounding treatments like lasers or microneedling to the area to, again, promote more collagen and elastin formation. You could also consider a biostimulator like Sculptra or hyperdilute radiesse injected into the area within the skin to, again, promote collagen synthesis, help elastin formation. Now, keep in mind, this is not a one-time thing. You are constantly aging. You are constantly being exposed to UV rays in the sun and inside, doesn't matter. So you're always fighting off the inevitable. So there's maintenance. So I would recommend doing something like microneedling quarterly, something like a laser or injectable, maybe annually, just for that maintenance to keep your results for as long as possible. If you feel like you're more noticing the loss of bone structure, loss of that gonial angle, you could consider something like a dermal filler to replace that bone resorption to give you more of that structure. And then, as always, consult with a plastic surgeon and talk about your surgical options. You can consider, if you're having more fat distribution and fullness in the submental area, yes, there are injectables that can dissolve that down, but for some people, there's so much of that adipose tissue accumulation that the amount of injectable it would take, the cost of that doesn't outweigh the cost of just having a surgical lipo to the area. Also consider talking to a plastic surgeon about what would be my cost and risk and benefits of doing something like a neck lift or a lower facelift compared to injectables or a product like Kybella to dissolve the fat or Sculptra or what have you. The choice comes down to what kind of downtime are you looking to have? How immediate do you want your results? What kind of maintenance are you looking for? And what's your budget? So the right answer is the right answer for you after you consult with everyone involved and talk about risks, benefits, alternatives, and realistic expectations. If you found this video helpful, please like and subscribe to this channel. I put out educational content related to aesthetics weekly. And until next time, guys, have a great day.